let me just, this is where I was before. In the back, my son had his music and stuff on, which is why I came in. But I'm going to take some notes.
Okay.
Okay, ladies, we're ready. Go now.
Hello, this is Behind the News. I'm your host and producer, Nellie Hester Bailey, here with my guest for the hour, Dr. Rosemary Neely. And we're going to talk about the COVID-19 pandemic that has swept through the globe. And we're going to take a look at the unique, historic island of Cuba, who in the midst of this global pandemic has sent a number of doctors to Italy, one of the hardest hit countries in Europe. But first, we're going to talk about the distinguished career of Dr. Rosemary Neely, who is an author, and we'll talk about that toward the end of the book, because I know that our listeners will want to get a copy of the book, Fidel and Malcolm, Memories of a Meeting, that was published and recorded the famous meeting between those two great leaders. Dr. Neely is a longtime activist and supporter of Cuba. She has worked in Cuba, and we'll talk about that later on. And she has been awarded and recognized by the Cuban government. But before we go into her illustrious career, we're going to talk about Cuba and what is going on with this global pandemic. So, Dr. Mealy, welcome to the program.
Well, thank you so much, Nellie. And I'm just so happy that you have this program and that you're able to bring the kind of news to an alternative listening audience that's normally not in the realm of what we know as the Cuba Solidarity Network. And hopefully, after listening to this program, many of your members, many of your listeners will decide that it's a worthwhile challenge to take part in something like that. So let's start out by just first framing the fact that everybody probably knows that Cuba had a revolution, and it was a trend, 1959, 1960s, that transformed their entire society, meaning that it moved out the exploitive capitalist system that we know that we are experiencing here, where people were starving, hungry, no education, no adequate health care. Farmers were being laid off and land was being stolen. And with the triumph of the Cuban Revolution led by Fidel Castro and what was known as the 26 movement, it was called the Moncada program that emerged, which transformed all of that, meaning that the society instituted a socialist path to assessing and creating a whole new society. Socialist path meaning that there was a total transformation structurally of the society. It meant also that the land was challenged and broken up, and farmers were given land in what was called the Land Reform Act. There was a whole move on the eradication of illiteracy, where thousands of young Cuban children and ages from 8 to 16 actually went into the mountainsides and the cities and all over the country and taught people how to read and write. And that's why you have such a literate society where people can read and write and think for themselves. And that was also a part of the transformative process. In addition to housing, people's housing, one pays one's rent allocated based on their salary. But I think what's most important, as we'll talk about today, is the healthcare. And how is it that Cuba was able and is able, as you mentioned in the early part of your program, to actually be sending medical brigades to Italy, to Spain, all over the Caribbean, where the Caribbean governments have asked for them to come with their healthcare professionals. How are they able to do that? So we answer that question. We answered that question.
Dr. Mealy, before we continue, just so that there is an additional historic content that led to the revolutionary social and economic and political transformation in Cuba, was that the July 26th Macata revolution, where they seized the barrack, is before that the president of Cuba was Batista, and it was the United States multinational corporations that extracted the wealth out of the country. It was a pleasure dome even for the U.S. Mafia, to be blunt about it. And so I think it's important for our listeners to understand the full realm of the exploitation of the island, because the U.S. propaganda has been so thorough and has so demonized this island of 11 million people with the title of communism, even though Cuba is a sovereign nation that has the right to determine its own form of political system. So I just wanted to add that so that our listeners can understand the full historic ramification of the exploitation of this island by multinational corporations and criminal elements from the United States. So I just wanted to add that addition. But let's continue, because you were about to, and this is the heart of our discussion, you are an activist and attorney, and it was you, along with attorney Joan Gibbs, another Cuba Solidarity activist, who wrote a letter that was in March of this year to the Congressional Black Caucus, asking for the lifting of the embargo against Cuba that is over 50 years, as well as the lifting of the travel ban. So can we start there with respect to why the letter was sent to the Congressional Black Caucus and some of the other demands, and really you brought to light the historic the development of the pharmacological as well as medical industry in Cuba that has been imported all over the world. So can we start with your letter and that of Joan Gibbs?
Yes, Nellie. The letter
Attorney Joan Gibbs.
The letter was written because, for your listeners, there's something called the Helms-Burton Bill. The Helms-Burton Bill is actually a draconian bill that really set the stage to deny any kind of developing relationships between Cuba and the United States. It's a bill that inevitably means that the only way that there can be normalized relationships between the two countries, Congress has to repeal the Helms-Burton bill. And, you know, just listening to what you said, you know, from the onset that Cuba decided to go along its own path of development, United States hates it, because 90 miles from its shores, it has a country that has a different social structure, as you've said, a different economic, and chose a different economic path than this one. So the hostility has, for the past 60 years, it's just been immense, meaning that countries cannot trade with Cuba. If something is made in Germany and it has a part that was made in the U.S. or the U.S. part has a copyright on it, that company cannot trade or sell to Cuba. For example, last week, the United States government denied ventilators being sold in Cuba because parts of the ventilators were made by a US company. So the draconian and the hostile and the inhumane practices of this, we call it a blockade really, has just done incredible, has just been incredible, incredible hostilities against the Cuban people. And it also has been a way that we have been denied access to the fantastic and the incredible scientific developments that this country has made, despite the fact that there is a blockade against the country. So I framed the answer to your question a little lengthy, but as I said, in order for any change to occur legislatively, it has to occur through the United States Congress, through the legislative process. And so in that context, we wrote to the Congressional Black Caucus, and we challenged the Congressional Black Caucus to raise at this particular moment a lifting of the blockade, and so that there could be more humanitarian trading occurring between the two countries, but also because of the technology that Cuba has developed in relationship to scientific technology, interferon alpha-2b, which is a drug that they have developed that was used in China as a protocol with COVID-19, and how as Black folk in this country and people in this country don't have access to that medication or that drug because of this draconian blockade. So that was the impetus behind our demand to the Congressional Black Caucus to consider during this moment that here's a time that they could rise up and really challenge the draconian actions of the Trump administration and what we call moving towards kind of like, I don't know if people like to hear the word, but moving towards a fascist approach to how we have to live in this society where the president wants to declare himself almost as king. So we were asking them to consider pursuing and promoting this issue, given their leadership in the Congress and based on their own personal experiences, because many members of the Congressional Black Caucus have actually organized delegations when Obama went that began the kind of like overtures to Cuba. We know in essence what the ultimate design was, but at least the country was opening up and there were diplomatic relationships were being developed between the two countries. So we explained to, well, we didn't explain to them, but because they already know, but we challenged the Congressional Black Caucus that in the advances of friendship and respect for mutual sovereignty that really began under the Obama administration, and that they have a responsibility to responding to people like us and people who would support our demand to actually act.
Mm-hmm. Given what you've said, one would think that the Congressional Black Caucus would be moved to embrace in not only ending the blockade, but also requesting aid and help to deal with the fact that Blacks disproportionately all over the country have been affected by the COVID-19 pandemic with respect to the disproportionate number of deaths, particularly among African American men?
Absolutely.
So what was, can you continue and tell us what their response has been so far?
Well, Neil, well, we haven't had any response, but I think what's been most important that came out of this, our pushing this letter, every major news broadcast in Cuba broadcast this letter and read this letter to millions of people around the world. All right, so at least the information is out there that the caucus was approached and letters have been sent. It also caused people to generate letters to the caucus asking them to consider the content of this letter and to move on some of the proposed suggestions that were in the letter. And I really want to say we're not the only ones that are doing this. There's also a campaign I think it was something like 5,000 or 6,000 people signed on to a campaign to actually get this medication into the US. So there's kind of like a movement around the country, but I think we chose to direct our appeal to the Congressional Black Caucus because they purport to represent the interests of the African people in this country and globally, they say.
Mm-hmm. Can you talk about what you believe might be the politics behind their non-response?
Well, you know, like anything, there's a recognition. There are some very progressive members, and I want to say this, and I want to publicly say this. There are some very progressive members of the Congressional Black Caucus. For example, Congresswoman Karen Bass, Congressman Barbara Lee, as a matter of fact, Congressman Benny Thompson of Mississippi, who is actually one of the people who met with Fidel Castro that ultimately led us to getting free scholarships for underdeserved students to actually go to study medicine in Cuba. It was Congressman Benny Thompson who proposed this idea to Fidel some 20-some years ago. But as I'm saying is, you know, like, you know, we have a community of elected officials who are tied to corporate America, perhaps maybe even, and I haven't done any research on this, maybe even to some of the pharmaceutical companies. So I think it's a struggle within the caucus itself to have a unified alignment on this question about Cuba, and then the anti-communism that exists amongst our community. I mean, so the progressive elements of the caucus, I'm sure, have received this. I mean, everybody got the copy of the letter, but maybe there's a struggle that's going on internally. I don't know. And then, of course, everyone will say, well, you know, we're really dealing with COVID-19 in our communities. It's a challenge and what have you. But here's a component of how we could use a kind of reciprocal scientific relationship between Cuba and the United States that could support and help in our struggle against this pandemic that's impacting our community more than any other communities.
Mm-hmm. Well, let's talk about the Cuban trained U.S. doctors who are here in this country. The Independent, a progressive newspaper here in the city, did an extensive article on a Cuban trained doctor who was battling the COVID-19 pandemic in the Bronx. Can you talk about that a little bit?
Sure. The doctor that you're mentioning is Dr. Melissa Barber, who's a graduate of the ELAM, or the Latin American School of Medicine. And as I said earlier, when President Castro came to the United States in 2000, yes, at Riverside Church, he announced that in the act of solidarity that has been, as the Cubans have expressed in Africa, Asia, and Latin America, that this expression of solidarity was being extended
And the Caribbeans as well.
Yes, that this act of solidarity was being extended to our young people, that any US underdeserved student, a young person who would be interested in studying medicine in Cuba, at that time they were awarding 500, he announced 500 scholarships, I think it was. But we needed, and this was amazing, we needed an instrument or an organization to help us to realize this. Okay, Congressman Thompson came up with the idea. Fidel liked it, as I said, but it took almost 2 years for this program to actually go into place. And we have to acknowledge the work of Reverend Lucius Walker of IFCO Pastors for Peace. IFCO, yes. Right out of Harlem, one of the first Black people of color 501c3 organizations that exist even to some extent at the level that it does now. But Reverend Lucius Walker, and I say was because he passed some years ago, decided that IFCO could become the organization that could facilitate recruiting these young people for scholarships. And so Melissa Barber is one of the recipients of those scholarships. Over the years, because of the economic situation and the fact that Cuba provides scholarships to thousands of students from all over Asia, Africa, Latin America, and the Caribbean, our numbers were reduced. I think we had 1 year we got 15, 10, but even that, it was just amazing. So we have been able to recruit, we have 175 doctors that have actually graduated from the program and that are practicing medicine in the United States. And Nelly, what's so incredible about it is when they return, they have no debt. Can you imagine returning from medical school and you have no debt? So you can focus on being a people's doctor. And they come with the skills of disaster medicine. And that's why people like Melissa, who was highlighted in that article, is so important, because Cuba teaches its medical doctors that there's a community component, a community organizing component to medicine, that medicine is not just something that's out there and that it's something that should just remain in a doctor's office, but that you need to know your community. You need to know how many people have high blood pressure. You need to have statistics on the number of people who have asthma, who have all of those underlying diseases that COVID-19 attacks first, right? So Melissa is one of our champions. She's one of our heroines, a single parent, and she's strong. She's showing through practice how being trained as a doctor in Cuba can be manifested in such a positive way. And we have doctors working in New York. We have doctors working in California, San Francisco, Washington, D.C., internists, and they're specialists, because when they come back to this country, they're able to pass their boards and they're able to practice. And we now have 70 students now in the country, in Cuba, who are studying medicine, and they're working too, because if I might say quickly, one of the things that Cuba is doing in terms of dealing with COVID-19 in the country, the medical students are actually going out into the community, door to door to door. Like I said, when I first came, they know how many people are ill, how many people have symptoms. And that information those stats are really important for the country, for the government as a whole, not province by province or state by state, as the president of this country is telling people that you're on your own, but there's a national a healthcare structure. And that's how they are able to effectively deal with this pandemic. And that's the kind of training that our doctors are returning to practice here in the US. There's one hospital in New York that says, I want every one of those who come to be there, to do residencies here. And that's how because they know that they're well trained, because why would countries all over the world be asking for Cuban medical brigades to come during this pandemic? And as they came and as they went in Haiti during the earthquake, by the way, Dr. Barber was also on the brigade that went to Haiti during the earthquake. We've had doctors graduating who went to Africa during the Ebola crisis. And so these are well-trained doctors, some of the best. And, you know, they're proving that scholarship and that training that they got, and they're giving back to their communities.
Can you talk about not only what you just said, but the humanitarian ideology that is embedded in this medical program? I have read that the Cuban approach is that of preventative measures, and not just reacting to a situation that presents itself, but an ongoing preventative ideology based on not only human need, but also human care, a humanitarian philosophy that is absent from the strictly capitalist approach, one of making money. Can you address that, please?
I'll try. Well, let's start by saying that embedded in the Cuban Socialist Constitution it's written that health is a
guaranteed health care,
and that it's a human right. You know, it started at that basis, that health is a human right. So if health is a human right, then that means you start with the individual and not look at what's profitable. All right. So it's also based on and you have to talk about how this trajectory of the pandemic, how that fits into the Cuban healthcare structure system, and how the medical professionals are taught. First, the Cubans look at overall, what are the conditions and organization of the society? How is the society organized? That's the first thing that they do. So given that Cuba is a socialist society, where from the very beginning of the triumph of the revolution, healthcare was, as I said, was built into the socialist constitution. The system itself starts at the community-based level. In every community all over the island, you have what's called the polyclinics. And that means that in every neighborhood, there's a doctor. That doctor lives in their apartment above the medical office. Just, you know, that's just an incredible thing to imagine. So if you go there and you go into the community, the first thing that you see is the polyclinic. So that's at the base. Any issues that the doctor and the medical personnel diagnoses that it cannot handle at that base level, because the whole approach, like we said, is preventive medicine. The person then gets moved to the second level of how the healthcare system is structured, the local hospital, then the specialty areas, et cetera, et cetera, et cetera. So in every community, with you having this family doctor who lives over the polyclinic and the staff who lives in the community, you have a healthcare system that's created and sustained in the history of the individual. And I think that that's probably one of the most, and that's why all over the world, healthcare systems and countries look to Cuba as a model, but that model cannot be duplicated in a capitalist system, because the state produces the medicine, right? It's not a pharmaceutical company that's producing the medicine, because what society has set up is that you have a whole scientific research center that does the research, and then and then that's why they've been able to come up with all these different kinds of cures and protocols that are modeled at by other countries. And you mentioned, like if I can quickly go through, there's one, for example, they found a cure for lung cancer, a vaccine for lung cancer. And that was really promulgated a couple of weeks ago, and it was surprising to see it on the PBS NOVA program. It's a joint venture that was really moving really well between the Roswell Cancer Center in Buffalo, New York, and the Cuban Scientific Center. So
yes, I was going to ask you, can we pause for a moment? Because despite the demonization and the propaganda against Cuba, more and more Americans, as well as people from all over the globe, understand and are aware of these scientific advancement in medicine in Cuba. As you said, PBS aired a special that was in March, the same month that you and Attorney Gibbs sent the letter to the Congressional Black Caucus, and it was about a hope for cancer. And as you said, the Roswell Park Center in upstate New York, I believe it's in, where is it again? Buffalo. In Buffalo. And Cuban doctors and scientists have been working together for at least the past 3-4 years, and these joint ventures that really inspires hope for this joint research to produce a cure for cancer and others, because here in the United States, 1 out of 4 Americans will be stricken with some form of cancer. So can you talk about that joint cooperation a bit more?
Well, none other than I'm not sure at what level that it's, after the Trump administration has basically reversed all of the positive measures that were undertaken when there was the new developments of relationships between Cuba and the United States. So a lot of those joint ventures are either on hold, or they've been, they're not functioning at the level that they were when they began. I don't know exactly at this point where those trials are. I don't know that, and that really didn't come out in the documentary as to how effective those trials have been. But the point is, we know that in Cuba, I've actually talked to people and doctors and individuals who benefited, who've actually had lung cancer, and their lifespan has expanded because they were able to get the vaccine. So on that level, we would have to go back to the Roswell Center to find out exactly, given how the Trump administration is blocking everything and really turning everything, destroying or just not funding research, not only to the National Health Association, but any other kind of research that would be in the interest of us. Then we know where he's going on that. But if it's okay, I would just like to tell you a couple of other beneficial scientific developments that occurred in the country that could be beneficial to us.
Yes, of course.
The other is they've also been able to, people who have diabetes, they don't do no one gets their foot amputated anymore. they've been able to develop a procedure where they can regrow the old the battered skin of the individual who has diabetes, and they don't have to amputate anymore. That's a breakthrough. I saw that myself personally. The other, when I was living and working there, vitiligo, which is a skin discoloring disease, they have a cure for that. They use the placenta, and that's been advanced. And years ago, when there was that horrible nuclear fallout in Russia, the Chernobyl fallout,
Yes.
and many of those children died. There were many children who died, but hundreds of thousands, as a matter of fact, children were evacuated from Chernobyl and were actually treated with the vitiligo protocol. Saved a lot of lives. And I actually saw a child also from Britain. When I was working there, I kind of followed the little girl, and I saw how the discoloration of her skin was changing back to normal from that treatment. Then, of course, the other is sickle cell anemia. I mean, who the genetic trait that Black folk and people of African descent, they use something called ozone therapy to treat that, which minimizes the pain, the horrible pain that sickle cell victims have. And so that's just another development that we don't have access to because of this blockade. So that kind of like, I mean, there are many, many more things. And right now, as of a couple of weeks ago, as of 2 or 3 days ago, we read in the Cuban newspaper that they are actually doing trials for a vaccine for COVID-19. We won't have access to that. And also they're using, they've started distributing a new medication, a homeopathic immunological booster amongst the island's population to help prevent viral infections like COVID-19 and other common flu and other people who are suffering from common flus. We're not, I mean, a homeopath, I mean, that's amazing. Again, we won't, because of this draconian blockade, the hostility and the need to want to control and have what they call regime change of a country that's 90 miles from us. We won't have access to any of those incredible and fantastic scientific developments that could impact and bring relief to our own communities. And some people might ask, well, how are they able to do this? Because the state sees the need of investing in scientific developments, investing in that, because again, it goes back to what we said earlier about how, healthcare is a right, and it's a part of the, it's a human right, and it's a part of the Constitution. And the fact that there are currently about 90,000 medical workers in Cuba, which and this is just a country of 11 million, because of they're training all these young people to be doctors. That's how they're able then to share this medical through these medical brigades to other countries. And it's not just something that just happened during COVID-19, but Cuba has been sharing their medical doctors and nurses, teachers all over the world. And it was, and there's been an attack against that. And if I could just quickly say this, the attack of Cuba having medical personnel throughout the world, the United States has attempted to tell people that they're trafficking in human beings, because they're sending doctors and nurses to underdeveloped countries, developing countries where this country would never go, right? The quote unquote shit. You remember what Trump said about all of our countries of Africa, Latin America, and the Caribbean. But the thing about it is, it's also a way that in countries that cannot afford to provide contracts for medical personnel. It's another way that they're able to have currency, but the doctors are still paid, and the U.S. wants to see that income dropped and destroyed, and that's another reason why you see the attack.
Yeah, there was a bitter and attack in Brazil, and that came under the right-wing President Bolsonaro, where Cuban doctors who seemed as if they had been paid or whatever launched an attack against the government. But we have to move on, and we have a number of other things to cover. Could you talk about the resolution that Cuba C, New York, New Jersey drafted and submitted to the New York City Council, calling on the City Council to issue a proclamation, if you will, against the blockade as well as the travel ban, and I believe a similar legislation by the City Council in Minneapolis had passed, and there was also an introduction of a similar resolution requesting the City Council in Washington to call for an end of the embargo. So can you start with the New York City Council and what has happened to that proposed resolution that was introduced by City Councilwoman Inez Barron?
Yes, thank you, Nellie. That came out of a lot of the work that you did and other people who worked in New York with this group that we will work with called CUAC, and the other Solidarity Forces, the National Network on Cuba, which is like a national umbrella organization that have been encouraging activists to approach their city councils or aldermen or whatever way that their city governments are structured, to have them to pass resolutions. And of course, we know that these resolutions are just symbolic, but what they do is they can be used as educational tools. They can be used to do the kind of information that you are doing here on this program to educate people about Cuba. And so when we approached Councilwoman Inez Barron and Councilman Adonis Rodriguez of Harlem, they were both quite amenable to accepting our suggestion. And we were able, and meantime, there was other kind of organizing going on, like we had petitions in the community to support the resolution. We have people writing to their other city council. And the New York resolution was really fast-tracked, as a matter of fact. It took us, just working with Inez and her staff, excuse me, it took us only like maybe a month to get the resolution drafted and written. And so the resolution is called New York City Council Resolution number 1092, where it was presented, and we had hearings. People came for hearings before the entire city council. Very, very positive. Councilman Brenham was very supportive. So the problem is the resolution got stalled, as with a lot of other things that got stalled in city council. But what Joan Gibbs, my colleague Joan Gibbs, and I did on March 20th, we actually wrote to the council speaker, Corey Johnson, and Majority Leader Lori Combo, and we told them that we said in our cover letter to them that hopefully that they were aware of this biotechnology industry that was producing all this great research, and how important this pharmaceutical, whatever comes out of it, would be important in our community. And we also told them in our letter that how China had built a factory with Cuba and China as a joint venture, specifically to produce this interferon alpha 2B, which, as I mentioned earlier, is successfully being utilized in was successfully utilized in China. It's been Italy. All the countries that have asked for Cuban medical brigades are using this protocol. And so we told the speaker and the majority leader that we felt that, and the fact that several members of Congress, as well as the person who had introduced the bill, one of the people who had introduced the bill, Councilwoman Inez Barron, had actually been infected and quarantined as a result of COVID-19. So we asked them,
as well as her husband, her husband, Assemblyman Charles Barron.
True. So we said, to this end, we urge that you support and present to the full City Council for a vote on this resolution, calling upon the president to lift the Cuban embargo and the travel ban. We haven't heard from them as well, and that letter was sent out on the 20th of March.
Mm-hmm. Mm-hmm. Let's return to the Congressional Black Caucus. You've said that you have not heard anything, and you talked about the support of Congressman Benny Thompson of Mississippi. What is your next step in regards to the Congressional Black Caucus? Will you continue to exert pressure? What is your next step?
Okay, as we're talking right now, there's another webinar going on around this exact same issue. And I think what's going to happen is that there's going to be a national campaign that will not only bring in the issues that we raise with the Congressional Black Caucus, but this national campaign will go to every member of Congress. So I think that that's really important, because there are other, for example, you have Senator Leahy from one of the northern states, who has a bill in Congress in the Senate calling for lifting of the travel ban. You have Congressman Bobby Rush from Chicago.
Chicago.
Yeah, from Illinois, who actually has a bill on the floor. And as the last time that was introduced in April, the last time that I read, he has something like maybe 35 or 40 sponsors already. And that his bill is actually calling for a repeal of the Helms, literally a repeal of the Helms-Burton bill. So I think all of these letters and these demands and these issues, they're going beyond the Congressional Black Caucus. They're going to the Progressive Caucus. Joan and I were talking that should be our next strategy, that to appeal to the Progressive Caucus. And,
yes.
And hopefully there are some folk in there who will take more of a lead in responding to us. But meanwhile, we have these campaigns that are currently going on, as I mentioned. There's also, I think the work that we're doing with these letters are also linked to this. There's a sanctions campaign going on, where we're calling for the lifting of sanctions in all these countries that during this
yes.
particular period are suffering tremendously from the lack of having apparel, equipment, gloves, masks, generators, all of that. So I think, everybody does what they can. Each one of us, we do what we can, and hopefully it sparks, another group of people to wanting to do something. I think most importantly, action is right now, the best we can do is the kinds of things that we're doing now. We can continue writing, we can do these kind of programs, the webinars, and when this thing is over, our society is going to be, it's not going to go back. People talk about when we go back to normal, it's not going to go back to normal.
Not at all.
From really looking and analyzing the delivery of healthcare in this country to how genocide was actually being perpetuated against Black folk and people of color. Because if you look at the stats, as you said earlier, we're the ones that are bearing the brunt of this, to how workers have to go to work. The farm workers down here in Florida, who don't have any protective gear. What's going to happen when they're not able to produce the fruit and vegetables that get sent out to the entire country? The meat packing workers who meat packing plants, I don't eat meat, but the meat packing plants having to close down because workers are being affected. The stimulus package, it's already gone for small businesses. So the society has to be transformed. I mean, there's no way you can go back to normal. And that's why Trump is calling for his right-wing militias to, I mean, I couldn't believe it. You know, 3 states, they're supposed to really go after those states and go out there and subject themselves and millions of other people to the virus because they believe that what he says is the right thing.
Well, I think our time is up, but now that we have conquered this new technology, it took some time. Can you come back next week for part 2? Is that possible, Dr. Mealy?
Actually, next week for part 2, IFCO Pastors for Peace, we're actually doing one around the same time. And it's going to be on the impact of COVID-19 in the African and the Black community and people of color community, and also Cuba 30 years of solidarity. So I'm going to be sending you some information on that. So I wouldn't be able to come back at this time next week, but at another time I would be happy to. At
another time. And what I would suggest is that we can plug my program into the webinar and so that our listeners can hear what's going on, and we can talk about that and how we can do that just in terms of dealing very specifically with the issue of Blacks being disproportionately affected. And to deal with, I don't know whether it's rumor or whatever, this propaganda, I'm not sure whether or not this is just media, is supposedly in the Black community that Blacks, that the COVID-19 pandemic doesn't affect Black people.
Oh, yes,
I'm not quite sure where that comes from, but we could do that as well. So we have 2 things to talk about. You coming back at part 2, not necessarily at this time. And the third is to plug this program into the webinar of IFCO.
Okay, if you can send me the information, I'll certainly propose that. I don't see any reason. We're going to be plugging in things to do. So things to do, places to listen. You know, let's add another category.
Oh, yeah. Okay. And I will contact you because we didn't get to the rest of your incredible work and your portfolio of the many things that you've done, not only as an author, but your work in Cuba itself and the awards that you have received from the Cuban government. So I am looking for part 2 of a time that is convenient for you next week, and we can talk about that. But thank you so much, Dr. Mealy. I'm sorry we don't have additional time. It has been a fascinating discussion, and the information that you have given to our listeners, and we thank you very much for this, and we will contact you for another date next week for part 2, and perhaps at that time we can bring on Attorney Joan Gibbs, who has worked with you on a number of major initiatives.
Okay, great,
So,
Nelly. Thank you so much.
All right.
And be safe,
Yeah,
Nelly.
thank you.
Okay.
Yeah, thank you, Dr. Mealy. Thank you.
Oh, okay, Nelly. Bye-bye.
Bye. Doug?
Okay.
Doug? Doug?
Are you signing off? You want to sign off?
Yeah, I did. I thought you were giving me warnings to sign off, and I had gone over my time. But she's going to come back next week at a time that's convenient now that we have this down. So how did you enjoy the program?
Okay, we're on the air right now, so let's sign off, and then I'll talk to you after that. Thank you.
Oh, okay. Well, can I sign off now?
Thank you. Please
Can I sign off?
Yes.
Oh.
Yes.
Thank you. Thank you for listening to Behind the News. I'm your host and producer, Nellie Hester Bailey, from the virtual studios of GHCR with our engineer, Doug Frazier. We will return next week with part 2 of our interview with Dr. Rosemary Neely. Thank you for listening.